Dear colleagues, Ukrainian Crisis Media Center continues its work. Our next topic is latest information on epidemic situation with the flu and ARVI diseases in Ukraine. We have Mr. Oleksandr Kvitashvili, Minister of Health of Ukraine, Lyubov Nekrasova, and Mr. Stanislav Protas, who is Executive Chief Sanitary Doctor of Ukraine. Good afternoon. Thank you for coming. As we promised, we are here again to update you on the latest information with the flu in Ukraine. From the very beginning, I would like to request that you should provide reliable information and verified information, because quite often I observe that mass media provide information which is not verified. I would like to thank to mass media who provided assistance and allowed to decrease the level of self-treatment in cases of flu, and people started to come to address to the polyclinics, to hospitals after our latest briefing, and that's a very good situation. I also would like to thank to all the medical workers who work with the population and who provide a lot of assistance. I believe that this will considerably improve the situation with public awareness. From the very beginning, I would like to state that there are no reasons for panic. Ukraine is in the same situation as our neighboring countries in Central and Eastern Europe. As of today, we have 51 mortal cases of deaths because of flu. That's because of late address to the medical institutions. That's why, once again, I encourage all the patients who suspect that they have a flu, whether it is flu or not flu, you should immediately appeal to the medical institution. We are coming. Those who say that we are approaching to the level of epidemic, to the level of pandemic, but these are conventional figures, just calculated conventionally per 1,000 of population. And for ordinary people, it does not matter. You should immediately call to doctor if you suspect that you have a flu. In Ukraine, we have 51 again case of deaths because of the flu. These are confirmed figures. Kherson and Rovno Oblast have very closely approached to the threshold of epidemic level. In some other oblasts, the level of flu spread is also rather high, so we are approaching to the threshold of an epidemic. So be careful and immediately go to doctors. I'm not an expert, but for example, when you observe that the temperature is lowering, then this is a good signal that the disease is repealing, and for example, in Donetsk Oblast. By the way, I wanted to say that please do not purchase Tamiflu medicine. Please do not use self-treatment. The Tamiflu medicine should be clearly prescribed to you by doctors. Please do not do self-treatment. Good afternoon. I would like to inform you about the figures. The official data shows that we have 2,300,000 and 33,000 of patients who had undergone the flu as of today, and this is official figure taken from the clinics and hospitals. The majority of those patients, 67%, were children. During the latest briefing, I mentioned the figure of 75% of patients among all the flu patients, there were children, which shows that adults started to experience flu. The highest level remains in Kiev Oblast, the lowest in Zakarpattia, Ternopil, and Kharkiv. In general, in Ukraine, we have 88,384 patients, which are now in hospital patients, and 64% out of that in hospital patients are children. I would like to thank the mass media for your public awareness campaign, because we clearly observe that the level of those appealing and to calling to doctors raised considerably. And this inevitably will result on the better and earlier diagnostics, and maybe not all of those patients who will call to clinics, they will be registered as a flu patients, but nevertheless, this will result in considerably better and earlier treatment of those patients. Our laboratories had collected more than 2,000 samples for tests. Even in Europe, this is huge figure. They usually collect not more than 300 samples. This shows that we are very much committed to understand what viruses circulate in Ukraine, and how many out of those viruses could be dangerous, really dangerous for the life of people. I also wanted to inform you about the following things. Last week we spoke to Francis Crick Institute from Millfield Laboratory in London, and we requested from them the information about viruses circulating in Europe, and to update us about the situation with the flu in Europe. They informed us that the level of medical treatment there is higher, and they have not registered any deaths because of Europe. And they also informed us that flu virus H1N1 California modification of virus had appeared, and This modification is called virus A New York 6. In Saudi Arabia, also new cluster virus appeared in September. In the United Kingdom, a new cluster virus appeared, and Iran, the cluster virus appeared in November. In the Irani, they did not provide too much information, but they also experienced problems. In Europe, the USA, and Australia, they have registered changes in the virus DNA. This picture shows changes in H1N1 flu virus. And I just wanted to illustrate that very significant European research institutions observe all the changes in this virus, while we in Ukraine have no facilities to do this. And no potential. So I just wanted to mention that all the patients who died and who suffered in Ukraine suffered because of H1N1 California virus. The very aggressive nature of this virus manifests itself in huge numbers of deaths. In 2012, we just had 2 deaths, and because the virus was not active and its circulation was not widespread. This year, the virus became more active. H1N1 virus belongs to those viruses who cause pandemia, and all the most prominent laboratories recognize that that these viruses are subjective to mutations, and they change, but nevertheless preserves its endogenous relativity with its parental virus H1N1. This is again like the same virus of H1N1, but it has a modification. You know that when there is a flu, you cannot expect the appearance of collective immunity. The immunity which is gained by a personal patient in result of flu may last just for 1 year. The flu is a unique disease in this respect. That's why our medical advice is that in case of any symptoms of a flu, you should immediately call to doctor, and because virus stays in your aerial bodies and in your aerial organs, and they become more dangerous when they multiply. And you should take a medicine like Tamiflu within 2 first days of the disease. So today it is very important to inform people where to call in case of the first signals, symptoms of a flu. And if patients know that they belong to the risk group, it is useful to go to undergo the immunization. There are companies which immunize you upon request, and they may arrive and immunize you. As of today, we may expect for a similar growth of in infection, the same growth of epidemic, and I could inform you that all the medical staff works hard to provide all sorts of necessary assistance and prevention work. I congratulate you on this your first in your life lecture on virusology, which might be very useful for you. I mentioned Kherson Oblast, Donetsk, and Rivne Oblast, which had reached the threshold of epidemic. Mr. Protas, the floor is yours. Good afternoon, dear friends. Dear colleagues, journalists, I would like to inform you on the measures taken by Sanitary and Epidemic Service jointly with the local authorities in order to hamper the epidemic growth in Ukraine. I mean the quarantine or the isolation measures. We have positive practice of stopping classes at schools, which immediately decreases the level of epidemic twice. Thus, we stopped school classes in Kiev in more than 4,500 schools and educational institutions. Also, we have posted the interactive map on our website showing the level of disease and circulation in the oblasts of Ukraine. We clearly understand that these measures, when we close schools for children, this is an extreme measure which creates problems for parents. Nevertheless, we address to parents, please do not allow children to go to the places where there are big crowds of people, neither to children's clubs nor to computer clubs, etc. So our general advice is to raise humidity in the premises, to feed children normally, to allow more vitamins in their daily diet, etc., and to allow them to sleep more. These are simple measures, but they nevertheless are good preventive measures. Now the questions and answers.
Good afternoon. Olena Feniuk, 1+1, several questions. Can you name the oblasts in which quarantine is observed? And the second question is the quarantine. We see that children are not at home. They go to some trading centers or to some skating grounds. So do you have some advice to them? Maybe in some big cities it's not good. Maybe we should air classrooms instead and not just send children home. And you said 51 people died, but on Friday they said that 52 people died. So on Friday we provided information on first 2 weeks, starting from 1st January till that Friday. And now this is the final information. So when the number of people who are infected rise, so there are more cases of death. So people don't address to doctors timely. So sometimes it leads to such tragic situation. We don't manipulate with figures. We can't do this. We have our obligations before people and before the European community. That's why this is very serious. And about quarantine, every oblast, and we are speaking not about oblast, about towns and cities. Of course, closure of schools is good, but if children attend some events where a lot of people, so it doesn't prevent them from getting the virus. So do you have other information? Today, according to the operative information, quarantine is introduced in 16 regions. Vinnytska region, I won't tell you about number of schools. This information is present in Dnipropetrovska, Житомирska, Zakarpatska, Kievska, Kirovogradska, Odessa, Poltavska, Rivnenska, Sumska, Kharkivska, Khersonska, Oblast, Chernovetska, Chernihivska, and Kiev. And I would like to comment on the preventive measures. There's no panacea from this virus. There's no such treatment, but every body of power and sanitary services, they analyze the situation that exists, and we understand clearly those negative social effects. And that's why I address parents. We focus on such important things where it can be active. When 30% of children are absent from school because of some respiratory disease, and if we don't have some forecast level that exceeds 1.5 times more than our expected threshold. So this is introduced only in those cases that it can be effective. And today we have some negative consequences due to weather conditions, and it is connected with the restriction of movements. And in every case, there are proposals by sanitary doctors, and decision is taken on the commission, by the commission in local government regarding all the aspects we were speaking about. And about the questions, I have a bulletin that is prepared daily, and the first page is on the website of the ministry, and starting from dynamics of the virus, and there are some contacts if you are interested. So every week this information is updated, and this data is presented to European institutions, and this is a part of the World Health Organization. And Flu News Europe is also an internet page for all who wants to get information on the development of the situation in the country. So we have an information bulletin. If you have time, you can look at it. So next question, please. RBK Ukraine, Sergei Laftar. three questions. First, about mortality from virus and also according to and in relation to the regions. And the second question is, you said that there's no grounds for panic because Ukraine is at the same level. You're speaking about mortality or about disease. Unfortunately, flu virus kills a lot of people in the world. In Ukraine, it doesn't matter what type of the virus, H1N1, A type or B type. If it's flu season, target groups they suffer more and they have decreased immunity, and that's why the virus is always threatening to them. And in some cases, there were pandemic situations of swine flu in other countries, and people were afraid, and they tried to defend themselves. And in case of California, H1N1, there are some death instances. So it's very bad, of course. But it's unavoidable, maybe. I won't provide statistics on this. When we are speaking about people, it's very difficult to speak about it. But there are more than there are 51 cases of death. It's not arithmetic. It's understandable that every person you shouldn't panic because of this. It doesn't matter whether it is epidemic situation. People should understand that there are some weeks that the virus is very active and you should address doctor and you should be vigilant. And as to the oblasts. Vinnytsia 5 people, Odessa 3. Give me several minutes. This function sum. So next question, please. Artem Sorokin, SDB. Maybe tell me, please, what is the cause of the death of these people? What does this virus influence on? So some people just cannot address, they don't have time. For example, their lungs are filled with some fluid, or they have very high temperature. Why people die? They die because of pneumonia. There's a syndrome. Acute respiratory syndrome. And flu causes it in the first few days. And the aggressiveness of this virus, of genetically modified virus, it is in the fact that it replicates fast, and it's so aggressive that this pneumonia is in an acute form, and people, they are hospitalized. And in Zhytomyr, for example, there was an example that 2 doctors, they provided help to a patient who died, and in 6 hours they had the symptoms of such a virus. And fortunately, they were in hospital and they got Tamiflu and they survived. And this pneumonia, 20 years ago, Americans introduced this indicator as primary. And here in Ukraine, we introduced this indicator starting from the 1st of January. We estimated this indicator, and we now can provide information on the number of people who die from this virus. And about the situation in Donetsk Oblast, you said, what about occupied territories? Did the terrorists introduce quarantine? What is the situation in hospitals there? Do they have opportunity to address for medical help? Do you have such information? First, the previous question about oblasts, and then I will tell you. Vinnytsia 7, lethal cases, I mean. Vinnytsia 7, Volyn 2, Donetsk 4, Zhytomyr 1, Zaporizhzhia 1, Kirovograd 1, Kalaevska 1, Odessa 20, Rivne 3, Kharkiv 2, Cherkasky 1, Chernovetska 1, Lviv 1, Kyiv 5. So in total there should be 51. I speak about Kiev city. So I can tell you only briefly about this because the information is updated and the situation is very difficult there in terms of infrastructure and medicines. And those centers that were built, they do not function, or they are looted. And the only thing we can help, how we can help, some humanitarian organizations, they provide help. So in such cases, people die from the aggression, but there are also such black holes in the sphere of public health. We don't have information about epidemiological situation, but there are a lot of problems with AIDS and other diseases, and this threatens the whole country. And that's why we should be ready to the situations when the territory will be freed. We will conduct work on localizing the problems that are there. And in these territories, no one take care about health, public health and prevention of different diseases. And there's a terrible problem for the country and maybe in the future for Europe. Question to Minister. In this situation, do we monitor the prices on medicines? Do you have some facts of some rise in prices? Because people say that the prices are on the increase. And how can we influence them, and how can we influence the situation? There's only one way how to influence on the price of medicines. We should decrease the regulation, taxes, and import duties. And we should increase competition on the market. Other methods, they don't have influence. We can provide some schemes, but we cannot influence it properly. So black market appears in that case. And that's why state shouldn't regulate the prices. We should create a situation of market economy, and I try for a year through the to introduce the laws of parallel import. It means that all the medicines that are regulated of the that if the states of if these medicines are allowed for use in developed countries, so for example, if some medicine is produced in Slovenia, that is sold in Europe and is allowed by the regulator for the European market, and is that it underwent all the necessary tests, and it is certified that it is proved that this medicine doesn't kill Europeans, should this medicine will be allowed for Ukrainians, and now pharmaceutical market in Ukraine is closed because of improper ways of doing things by trying to help local market. We put some obstacles that influence competition on the market. So competition is the only way. So we should establish a competitive situation on the market. But there's information that the prices are on the increase, and I'm not speaking about future draft laws. We're speaking about the situation at the moment. So prices on oil fell, but the price of the gasoline is the same. So the simple answer to this, oil as medicines, they are bought for foreign currency, for example, $30, so you should return your money back. So if you bought it, you bought, for example, many thousands of tons. How can epidemic of flu influence the medicines for example, maybe, but December and January, these are the months then the prices are on the increase, but the medicines that are bought for currency, and you know that there's a change in rates, and these rates influence the price. That's why we should open markets. Thank you, Mr. Minister. And do you have some other questions or comments? If there's no comments or questions, thank you for coming. Until the next time, goodbye. Colleagues, I remind that our next briefing, as it